Wheezing in children is more common during the winter season and can be an early sign of breathing difficulties that need medical attention. Cold weather, viral infection, and increased exposure to indoor allergens can cause airway inflammation, leading to wheezing, coughing, and shortness of breath. Conditions such as asthma, bronchitis, and chest infection often worsen during this time. Parents should watch for warning signs like noisy breathing, rapid breathing, chest tightness, persistent cough, or reduced activity levels. Early diagnosis and proper treatment can help relieve symptoms, prevent complications, and improve your child's comfort and sleep. Consult a doctor if wheezing is frequent, severe, or accompanied by fever or fatigue. Protect your child's respiratory health this winter. Visit Adam and Eve Medical Center for expert pediatric evaluation and care. Thank you very much.